Stiff knees, achy hips, and even swollen hands. Well, if you're 50 or over, it could be osteoarthritis, a common wear and tear disease that affects millions of people worldwide. It happens when the cushion-like tissue between the bones breaks down over time, which obviously would lead to joint pain. Dr. Stephen Ratterman, board-certified orthopedic surgeon, joins us now to talk about it. Good to see you. How are you today?
Thank you. Very well.
So let's dive in. I feel like, so many times people start to feel symptoms and they may just chalk it up to, oh, well, this is part of, growing old. But I mean, arthritis really does have an impact on joints that you see day in and day out, I'm assuming.
It used to be thought of as the osteoarthritis was something that occurred in old age.
Yeah.
As we've gotten more sophisticated, there are certain diseases such as rheumatoid arthritis that can wear your joints out early. Certainly if you've damaged your joints from trauma, that can be a cause of it. But you're blessed with a certain amount of covering for your bones, and as you age, that covering tends to age with you, and as it ages, it thins out. As it thins out, everything is going along pretty good, but then all of a sudden, once that covering completely wears off, you're rubbing bone on bone, and bones have a very rich nerve supply, and that really hurts. So that will really increase the pain symptoms at that point.
As I kind of just mentioned, I feel like some people, when they start to develop, joint pain and things, you just chalk it up to, oh, it's hard to get out of bed. Oh, I'm aging. When is the time to see a doctor or maybe even a surgeon? Like, when do you do that? Pick up the phone.
We tend to tell patients to let pain be your guide. Certainly the treatment ladder would consist of you can take over-the-counter medications such as Advil or Aleve. And at that point, if you're still having pain, you can go see a doctor. Maybe your primary care doctor would prescribe you some prescription level medicines of that strength. If you still are having pain, and it's affecting your everyday activities, not so much I can't run a marathon, but you can't even get out of bed, for example, without stretching for a few minutes, then we can start looking to see somebody like me as an orthopedic surgeon, and you could do like a cortisone shot in your knee, or there's a lubricant or gel shot that you can do. Then things start escalating at that point.
Well, I'm glad you brought up those shots, and I was going to ask you, as an orthopedic surgeon like yourself, is there treatment without surgery options? And I think you just gave a few of them. Anything else? Because I feel like that might sometimes hinder when people want to actually pick up the phone because they don't necessarily want to deal with surgery.
Yes, when people see that there's a surgery in your name on your coat, they immediately start getting some medical anxiety over all that. So we try to right up front put people at ease and say, look, there's a number of things that you can do before the dreaded surgery word crosses the desk.
Yeah.
And so the shots are always a good way to start. And none of those are one and done. You can repeat them. If they last, for example, your first cortisone shot might last a year, and then the second one may last 6 months. But you can continue that until you start to have pain that breaks through in less than 3 months. At that point, that's another red flag that things are getting increasingly severe.
I've heard with other surgeries and just medicine overall, we always talk about the advancements and things. Say a person is facing surgery and you're like, look, this is where you're going. This is what's going to need to happen. What are some advancements, though, when it comes to surgery options?
So the surgery, basically, if I showed you implants from the 90s versus the 2020, unless you had a biomedical engineering degree or a good eye, you would say they look all the same to me. Which really changes how we put them in. And so in the modern era, we do outpatient total joints, whereas you used to have to be in the hospital for a week, maybe a rehab center for a week. You would be on a walker for 6 weeks and then a cane. Now we get the surgery done on a Monday. You go home Monday afternoon after walking a couple hours in the recovery room, and then we get therapy at your house. The early pain stage that used to be pretty severe has gotten much better because we do a series of blocks. So the anesthesiologists and the surgeons will do these special long-acting pain medicines, and we block all around the operative area so that when you used to wake up and have an incredible amount of pain, nowadays you're able to do a crossword puzzle in the recovery room, and you're able to get up and go and start hitting your rehab goals much, much quicker.
Oh, I like that, which of course is a win-win for everybody. Well, Dr. Ratterman, thank you for coming in and talking about this on this Medical Monday. And we want to make sure and share the website so people can get in touch with you. Of course, today we're talking FloridaOrthoExperts.com. Again, all happening at Advent Health. Thank you again for your time today.
Thank you for having me.